This is Rural Health Leadership Radio.
Episode 174, a conversation with David Bowyer, Department Chair and Associate Professor of Pharmacy Practice at the University of Charleston School of Pharmacy.
You have to be willing to take chances and be willing to stand up for what you believe in.
Welcome to the Rural Health Leadership Radio with your host, Dr. Bill Oxier. Each week, Dr. Oxier has a conversation with a different rural health leader to discuss what's working and what's not working in rural health, along with other topics of interest to rural health leaders. Rural Health Leadership Radio's goal is to improve health in rural America by providing a simple, no-cost means to share information and connect rural health leaders from around the country. And now, here's Dr. Oxier with today's guest.
Today, we're talking with David Bowyer. Dave is the Department Chair and Associate Professor of Pharmacy Practice at the University of Charleston School of Pharmacy. Thanks for joining us here on Rural Health Leadership Radio today, Dave.
Well, thank you, Bill. I appreciate the opportunity.
So tell us about yourself. Who is Dave Bowyer? What's your story?
Well, I'm a native of West Virginia. I was born and raised in a small coal mining town in the southern part of the state. Left there in 1978 and went to West Virginia University and graduated from the School of Pharmacy in 1984. So I've been a pharmacist for 35 years.
Oh, wow. Okay.
I worked in a variety of different settings, both hospital and community pharmacy. And 14 years ago, I made the transition to academia as a what is called an experiential director, which means I'm in charge of placing students on rotations.
Okay.
Since then, I've been promoted to department chair, and I have a department of about 12 pharmacists that work under me. I've done a lot of different programs since I've been here at the school. When I started the school, the dean told me that since I was the native West Virginian, I was the one who was in charge of advocacy and things like that, which led to my involvement in the Rural Health Association here in West Virginia.
Awesome. Man, that's an interesting story. You've come a long way from that small town in West Virginia.
Yeah, it's been quite a journey. So.
Yeah, so, you probably could have chosen a lot of different career paths. Why did you choose healthcare? Why did you choose being a pharmacist for an occupation?
Well, I always knew I wanted to go into healthcare. I'd originally planned to be a physician because when I was in high school, everybody said, well, you should be a doctor. Okay. And then when I went off to college, became a little disenchanted with physicians and medical profession. And I had a high school friend whose father was the local pharmacist in the small town I grew up in. And I always liked how he was able to relate to his patients and liked how he was able to treat them. And when I was looking for a different career, I was, very enthused about going into becoming a pharmacist because it kept me in the healthcare profession, but allowed me to take care of my patients in a little different way.
Interesting. It's amazing the power that someone influential in your life, or mentoring. What an impact that can have on the career path you choose. So that's cool that you had your friend's dad. Why did you choose to focus on rural health, Dave?
Well, I don't know whether you've been to West Virginia or not, but it's a very rural state. It is the only state that is entirely in Appalachia. Every county in the state is in Appalachia. And its people face a lot of challenges. A lot of the people I grew up with and, have faced a lot of challenges in their lives. And I felt a very strong desire to help people overcome those challenges. I did that as a pharmacist. And then, like I said, when I had the opportunity to work here at the School of Pharmacy, and it gave me the opportunity to do some things like work in rural health, I was very excited to jump on the opportunity and follow up on that.
Yeah, so it's part of who you are, being a West Virginian. It sounds like.
Yep, that would be the best, shortest way to describe it. Okay. Most everybody in West Virginia has a desire to help people.
Yes,
and this was my way of being able to be involved and try and make a difference in some people's lives.
That's great. That's great. Thank you. Now, Dave, the name of this program is Rural Health Leadership Radio with an emphasis on leadership. So what's your definition of leadership?
Well, I believe in what's called servant leadership. You have to have a servant's heart first, and then everything else kind of falls into place. You can be a servant and not be a leader. But it's the willingness to put yourself out there to make a change is what really defines some type of leadership. You have to be willing to take chances and be willing to stand up for what you believe in. Sometimes sometimes there are consequences to that.
Yeah.
I always tell the students that you can have confrontation if you're going to be a leader, you have to be willing to expect confrontation, and you have to be willing to work through that. And that's kind of my definition of leadership, is someone who is willing to put other people before themselves and then be able to lead people to make things better.
Thank you. I appreciate that definition. I, too, am a big fan of servant leadership. So thank you for emphasizing that as the framework of your definition. Now,
you want to make sure you do things for the right reason. You don't do it for yourself.
It's not about power and authority.
No.
Well, thank you. So you mentioned, you obviously you're the chair of the department at the University of Charleston School of Pharmacy. Can you give us an overview of the school and the university?
Sure. Well, the university is a small liberal arts university, and it's located in the state capital of Charleston, West Virginia. The School of Pharmacy was the first graduate program here. We also have in other healthcare fields, we have a nursing and a PA program here on campus, and a couple other small programs. Our program at the School of Pharmacy focuses on developing the student to be a caring and knowledgeable professional. We want to make sure we can train them to be knowledgeable, but if they're not a caring professional, then we don't feel like we've done our job. As a faculty member, we have a lot of respect for the profession. We feel that pharmacy is a very honorable profession, and it's one that we want to make sure our students know that it's a very challenging profession. Also, being in the state capital, we focus a lot on advocacy with our students, and we want our students to become agents of change. We want them to be able to go out when they graduate and be leaders and be people who are willing to stand up for what's right.
I appreciate the fact that you emphasize the professionalism, because you can be the smartest guy in the room, but that doesn't necessarily mean you're the best whatever, whether it's a pharmacist or whatever, or a leader for that matter. So that's cool that you emphasize professionalism, and that the advocacy piece of that's very important too, because a lot of people don't get that.
Well, we feel like that we're here to uphold the standards of the profession. I mean, a lot of people look up to pharmacists. Pharmacists are the, I think, third most trusted profession now. We used to be the first most trusted profession. And, so obviously a lot of people look up to their pharmacists. And we try to instill that in the students is you have a responsibility to your patients. And, advocacy is part of that responsibility. Being a professional, both on the clock and off the clock is part of that responsibility also.
Yeah, especially in a small town, that's for sure.
Yeah.
So can you talk about the changing dynamics of education of pharmacy students today, and talk about immunizations too, if you would?
Okay. Well, pharmacy's changed a lot over the past 35 years since I came out of school. When I came out of school, the pharmacist was more of a dispenser of medications, and we were, in charge of making sure the patients had the right medicine at the right time. They didn't have any interactions, things like that. The profession has evolved into more of a pharmacist being a member of the healthcare team, making recommendations regarding medications. We in a lot of instances in the hospital setting and also in the community setting, we're the one that physicians turn to decide which medicine which medicine would be best for the patient. We're more involved in managing patients' medications now. In a lot of cases, pharmacists will, look at lab results and make recommendations on changes to medications regarding diabetes and blood pressure and things like that. And immunizations plays right into that. immunizations is one of the greatest examples of public health efforts in the 20th century. And the pharmacist being readily accessible, we felt like as a profession that we were in perfect position to start giving immunizations. And I think in all 50 states now, pharmacists in some way, shape, or form can give immunizations. We feel very strongly that that is a public health effort that we can take a lead role in. And, people go to their pharmacist, pretty much every month, whereas they may only go to their physician every 3 to 6 months. So immunizations are a way that we can, help people become more, better health-wise.
Yeah,
it's always better. It's always better to protect someone from a disease than to try and treat the disease after they have it.
I have to admit, I was shocked. I had a pharmacist give me an immunization a couple of months ago, and so I asked her. I said, "Well, are you a nurse practitioner or what?" She said, "No, I'm a pharmacist." And so my kids accused me of living in the past, so maybe I am there with that changing role of pharmacist today. So that's pretty cool.
Well, the American Pharmacy Association has a really good training program. It's the students do 20 hours worth of self-study, and then 8 hours worth of hands-on training in the classroom to learn how to immunize. It's not just immunizing. It's not just sticking a needle in someone's arm, but it's learning about the different vaccines, what type of problems they can cause and everything like that, and making sure that we give the right immunization for the right patient.
Well, thank you, David. That's some great information. Right now, we're going to take a quick break. Then we'll be right back to continue our conversation with today's guest, Dave Bowyer, Department Chair and Associate Professor of Pharmacy Practice at the University of Charleston School of Pharmacy.
Dave was just talking about immunizations, and as we all know, immunizations are designed to strengthen our immune system to prevent us from getting sick. In similar fashion, the National Rural Health Association's Rural Hospital CEO Certification Program was created to strengthen hospital systems to prevent them from getting sick. Now, this program is the first of its kind. It has been developed by successful rural hospital CEOs for rural hospital CEOs, as well as aspiring rural hospital CEOs. Now, if you'd like to learn more or even fill out an application, you can simply go to the website, www.ruralhospitalceo.com. I would suggest that you don't wait if you're interested because space is limited and the applications are coming in much more quickly than we had anticipated. Now, another immunization that I wanted to tell you about is a boot camp called Leading with Impact in a Disruptive World. Kathy Whitmire and I will be facilitating this program January 22nd through the 24th in Atlanta, Georgia. And it's all about making the transition to value-based healthcare. It's going to be an excellent program. You can check that out at www.healthcareleadershipbootcamp.com. And there's one more opportunity I wanted to mention, and that's the Rural Health Cafe Mastermind Group. It's been a huge success when we started that, and we'd like to start another group. Now, if that sounds of interest to you, just send me an email to bill@billoxier.com. In fact, on any of these things, you can always send me an email to bill@BILLAUXIER.com. With the Rural Health Cafe Mastermind Group, every single participant in the current group talks about how much value they get from the collaboration, the idea generation, the networking, the brainstorming, and it goes on and on how much they appreciate the other folks in the group. So if that sounds interesting to you, let me know. Now, back to today's guest.
We're having a very interesting conversation today with our guest, David Bowyer. Dave is the Department Chair and Associate Professor of Pharmacy Practice at the University of Charleston School of Pharmacy. Right before the break, Dave, you were talking about the expanding role of the pharmacist, including immunization. So to continue on that theme, can you talk about the working relationship between providers and pharmacists?
Sure, Bill. That that's one of the things that I really enjoy talking about, because it's something that is evolving and changing, and we hope will continue to evolve and change over time. When you work in the hospital setting, a lot of times now, you will have a pharmacist on the medical team with the physicians as they round. When you see in larger hospitals, you'll see teams of physicians, meeting with patients and taking care of patients. There's a lot of times there's a pharmacist on that team now. And, we feel like that the physician, is always the person in charge and the person making the diagnosis. But our role is to help them decide, once that diagnosis is made, what is the best medication for this patient. And, that started out in the hospital setting, but now it's evolved into more of the community setting. And there's a lot of areas of the country where there are pharmacists who are working in the doctor's office with the physician and managing the patient's medication. Diabetes is a really good example of this. The physician would make the decision to decide to start a patient on a diabetic medication, and then they would turn the care of that patient over, not totally, but turn it over to the pharmacist. And the pharmacist would look at the lab results and talk to the patient and see how they're doing and things like that, and then make a recommendation back to the physician to, maybe change their medication, maybe add another medication, or to increase the dosage of a medication. And it's all about, better patient outcomes. Like I said, I've been out of pharmacy school 35 years, and there's been a real explosion in the number of medications and the treatment of patients in that 35 years. And it's always been my contention that healthcare is so complex now that a physician can't handle it all by themselves. So they need to have a real team aspect, and having a pharmacist on that team leads to better patient care.
Yeah, that's pretty exciting and pretty cool. The team approach and engaged approach to patient care, very important today, that's for sure. I remember back in the 70s, I'll date myself here, back in the 70s, looking at the PDR and how big and thick that was. I mean, they probably don't even print that anymore, do they?
It's on a computer.
Yeah,
So.
It's because it's so big, right?
Right.
Yeah, and who can keep track of that? I guess you can as a pharmacist. That's part of your responsibility, right?
Well, we have a lot of support with that, and a lot of resources that we can use. But yeah, we feel like that pharmacists are the medication experts, and questions about medication, decisions about which medication to use really fall under our purview. And a lot of physicians are coming to realize just exactly how much better the care of a patient is if there's a pharmacist involved in their care.
Yeah, absolutely. I mean, it didn't come out the way I wanted it to, but I was thinking that for a physician, how can he or she keep track of all those drugs, because there are so many? So to play into exactly what you're saying. So that's pretty cool about the changing role of pharmacists. Can you talk a little bit more about the expanding role of pharmacists in rural health?
Well, in rural health, we talked about immunizations before. In rural health, there's such a problem with access to care that pharmacists can play a really critical role in a lot of rural areas. Immunization is just one way that can occur. A lot of times in rural areas, especially adult patients don't get immunizations like they need, like pneumonia vaccines and shingles vaccines and things like that, simply because they have to, load up and go drive an hour to see a physician, right, when they can see their pharmacist in their local hometown. So that's the other role, as I said, is a lot of times after a patient is diagnosed, they may come back and their local pharmacist may manage their diabetes care or their blood pressure or something like that, and in consultation with the physician who may be, a great distance away. If you're in West Virginia, it's a very mountainous state, and sometimes to get to a larger city, may be an all-day trip that patients just aren't able to, for a variety of reasons, just aren't able to get there. And so, they won't go to the doctor, they can't go to the doctor simply because of access issues, but they can always go in and see their pharmacist, and the pharmacist can then pick up the phone and call the doctor and say, this patient is having a problem, with their diabetes. I would recommend that we increase the dose. And then if the physician agrees with that, then the pharmacist can handle that right there in the local community. So it really has led to an expansion of what a pharmacist can do. In some states, a pharmacist can now even prescribe.
Oh, wow.
That's an area. It's a very limited number of medications that can be prescribed here in West Virginia, for example, and also in Oregon and California and a couple other states. We just had a law passed this year that will allow pharmacists to prescribe birth control pills, which is an area where it's under a protocol, so there's an oversight from a physician. But it's an area where we feel like we can expand, and there's a variety of areas where a pharmacist can take a better role in helping people live healthier lifestyles in these rural areas.
Yeah, because like you said, access is such a problem, and transportation and all that sort of thing. And in West Virginia, I have been to West Virginia on all the mountains and everything. I mean, you might not be that far from where you need to get to go as a crow flies, but to drive there is another matter with all the twists and turns and those mountains in the way. So that's great with the expanding role that pharmacists can fill there in rural health in particular.
And when you were talking about the mountains and things like that, a lot of times it's simply being able to get off work. Yeah. Somebody who doesn't have sick leave or things like that, if they have to take an entire day to travel to Charleston, for example, to go to the doctor, that's an entire day's salary, and that's very challenging for a patient.
Yeah, absolutely, absolutely. Well, that's good. The things that you're doing to expand that role and the laws that have been passed in West Virginia that help you do that. When we talk about expanding roles there, the reimbursement issues always come to mind too. So what about reimbursement issues? Well,
reimbursement is always a challenge. Every time you expand what a pharmacist can do or any provider can do, there's always going to be challenges with reimbursement issues. Reimbursement for medications, strictly, what a pharmacist's traditional role is of filling a prescription, those reimbursements are always going down. They're always being, tightened down by insurance companies, and there's always challenges with that. What we in pharmacy are looking at is things like I mentioned the birth control pills before. What kind of reimbursement are we going to receive for our knowledge of making sure that these patients have not only get the right birth control pills, but patients who maybe for complications or side effects or things like that need to see a doctor first. If they see a doctor, then maybe we don't get reimbursed at all for that 30 minutes that we might spend talking to a patient about their care. And so we're looking at areas of reimbursement of if a patient would go to a physician and do that, the physician would be reimbursed.
Right.
But a pharmacist traditionally is only reimbursed for the product they receive. So what we're trying to do is work with various payers to make sure that we're reimbursed for the knowledge that we provide. And that's challenging, to be quite honest about it.
Yeah. I'm sure it is, but it's warranted.
We feel that is.
Yeah, of course. Yeah. So can you talk about switching gears from reimbursement? Let's talk about innovation. Rural health is known for innovation. What's the latest innovation in rural health when it comes to pharmacy and pharmaceuticals?
Well, there's a couple of areas. Going back to kind of the changing dynamics of pharmacists and things like that. One of the programs that we have in West Virginia is a program called the Face-to-Face program, which is a diabetes management program that we've been able to work with the West Virginia Public Employees Insurance Agency to allow us to manage patients' diabetes. And they are reimbursing pharmacists for that.
Oh.
So we get reimbursement for meeting with the patient and going over their medications and making sure they're managing their diabetes appropriately. And it's based off a project that was done in Asheville, North Carolina, originally called the Asheville Project, which has been very successful in showing better outcomes for patients. And it's an area where I think a lot of growth is available in pharmacy practice and will lead to better outcomes for patients. Some other innovations are in the area of telepharmacy, where once again, it goes back to an access issue. We talked about pharmacists being in the clinic to help patients better manage their medications and to better educate the patients about their medications. Well, not every clinic can afford to have a pharmacist there. But in the area of telepharmacy, they can have patients sit down at a computer screen and consult with a pharmacist over their medications. That's an area of growth in a lot of rural areas where you may not have a pharmacist in the clinic, but you have access to a pharmacist in the clinic. There's also things like remote fill and central fill, where you may have it may not be economically feasible to open a pharmacy and pay a pharmacist to be in a small town. There just may not be enough people to make it economically viable. But you could remotely fill those prescriptions at a central location and then provide them to the patient. And along with telepharmacy, provide the education to the patient without the pharmacist actually being there. So I think those are a couple of innovative areas that we are looking at in pharmacy to kind of expand access to patients' medications, and more importantly, education about those medications.
Yeah.
If a patient is not educated about how their medications work in their body, I think that is probably one of the biggest problems that patients have, is knowing how these medications react in their body and knowing what to look for to see A, that it's working, and B, that they're not having some side effect from it that might be detrimental to them.
Yeah, absolutely. Because it seems like people more and more want to be in the know about what's going on, as opposed to blindly following physician or pharmacist orders. So that's great that you provide that education.
Well, and that's a good thing. Like I said, that's what we want. That's what we want, patients to be educated about their medication. And like I said, with telepharmacy, we can do that in a more economical fashion. Yeah.
Can I ask you a quick question about telepharmacy?
Sure.
So if a rural hospital, critical access hospital, whatever, let's say they only have one full-time pharmacist there. So for emergencies at night, could they use the telepharmacy for nighttime as opposed to having the pharmacist be on call? Is that how that would work?
Yes, that's exactly how that would work.
Okay.
We have a lot of rural hospitals that use what they call a night watch service, or a 24-hour service that supplements the pharmacist and provides education, is able to answer questions, and even utilizing automated dispensing machines will check medication orders that come in the middle of the night. The physician, maybe a patient comes in at 11:30 at night and the pharmacy is closed, and they need this medication right now. So the physician would write the order. It would be transmitted to a central location where a pharmacist would then review the order and would release the medication using an automated dispensing machine back in the hospital for the patient.
Interesting.
So it allows the patient to get their medication in a much more timely manner than waiting till 7 o'clock the next morning when the pharmacy's open.
Those are some innovative things going on. Thank you for sharing all that, Dave. So, Dave,
Okay.
you as you said, you've been a pharmacist for 35 years, both practicing pharmacist and now academically training our pharmacists of today and tomorrow. What scares you the most about the future of rural health?
Well, I think what scares me the most is the shortage of providers. We are in a time where there is a severe shortage of a variety of different providers. Primary care physicians are in short supply. Physician assistants a lot of times are in short supply. And a lot of these rural areas, there's not sufficient resources for these patients. I worked in a rural hospital where, the physician who delivered babies was on call 365 days a year. And that's just not a good situation for anybody to be in.
No.
So, having these providers have some type of life along with taking care of their patients, which they all love their patients and they all want to take care of their patients, but there's a balance there. I mean, they can't do it 365 days a year. And so I think, the shortage of these providers is a lot of times first felt in a rural area. If you have 2 providers leave in Charleston, West Virginia, for example, which we have about 50,000 people in Charleston proper. If you have a couple of physicians leave that area, it's not a large problem. People find other physicians to take over for their care, things like that. But if you are in a rural community of 5,000 to 10,000 people, and you have one physician, and that physician retires or leaves, or whatever happens to them, it can be a very challenging time for these people to get care. Reimbursement rates are always a problem with rural healthcare. I think advocating for higher reimbursement levels in a lot of underserved areas, and underserved areas doesn't necessarily mean rural areas, but a lot of times they go hand in hand.
Right.
Improving reimbursement in a lot of those areas, would go a long way to enticing, our younger physicians to come out of medical school and practice in a rural area. Physicians, pharmacists come out of pharmacy school and medical school today with a ton of debt. And, the reality is they need to look at their future and what how they can make a living. And so as, advocating for higher reimbursement levels in some of these rural areas is what I think needs to be looked at, because it's about supply and demand. And like I said, what scares me most is a lot of areas where rural hospitals are closing, and the physicians are leaving rural areas, and just the access to care for these patients. We talked about it before. A lot of these patients can't afford to drive 2 and 3 hours to go to their doctor, and they also can't. If there's a crisis, an emergency situation, they can't. They may not live long enough to go 2 or 3 hours to to get care.
Could be life or death.
I'll take you back to the small community or small county in West Virginia where I grew up. There is no hospital in that community now. There is no emergency room. They have to travel 30 to 45 minutes via ambulance to get to the nearest hospital.
Oh, wow.
And if somebody's having a heart attack or a crisis situation, that's a huge issue.
Yes.
And so that's what scares me the most.
Yeah, rightly so. Well, let me flip that question around for you. What excites you the most about the future of rural health?
I think what excites me, and this is purely a kind of biased opinion because I am a pharmacist.
Okay.
I think what excites me the most is the acceptance and willingness of the medical community to utilize the pharmacist and utilize other members of the healthcare team to be their extenders and to develop a real team approach to healthcare. As I said, I came out of school 35 years ago, and there was a definite hierarchy of medical care. It was, the physician was the lead person, and he directed the pharmacist to fill this prescription. And now what you're seeing, and like I said, what leads to better care, better outcomes for the patients, is a more team approach.
Yes,
where a physician will diagnose, and they may look at the pharmacist and go, okay, this patient has diabetes. They have this complicating factor. They have this. What drug would you recommend? And then the pharmacist would recommend the medication, and the physician would agree to that. And there's a real team approach to it anymore. And that is the biggest change I've seen over 30 years. And if that continues, and I don't see any reason why it won't, I think that will lead to better care of the patients. I mean, there's a number of studies out there that say that a team-based approach to healthcare leads to better outcomes for the patient, and that's what it's all about. Is better outcomes.
Yeah, and it's interesting. Unless you work in healthcare, you may not realize how relatively new this team approach really is, which was rather cool. But making a difference, that's for sure. Dave, we've covered a lot of territory in the short time we've been talking today. If our listeners only take one thing away from our conversation, what should that be?
Well, I think from the patient perspective, if you're talking to a patient, I think that one takeaway that I would like to see the patients have is to be involved in your healthcare. Be a member of that team. Ask questions. You talked about a little bit ago about patients wanting knowledge from their healthcare providers, which I think is a great thing. Be that person who asks those questions. We don't mind as healthcare providers. We do not mind. As a matter of fact, we train our students to make sure you answer every question that patient has and make sure that patient does not walk away with any questions unanswered. So be an active member of that healthcare team. It is your care, and you're the one who is, being the most impacted by that. And that's, if you're not knowledgeable in that can lead to bad outcomes. So that would be the one takeaway for the general public would be to make sure that you're asking all the questions and you're very knowledgeable about your disease and about your medications that you're taking. There's a real issue these days with patients still, in spite of a lot of technological advances, still just coming in and doing exactly what the doctor says or the pharmacist says without questioning it. We don't mind answering questions. Matter of fact, we welcome questions, and we want you to be knowledgeable about that. So that would be my one takeaway.
Thank you, David Bowyer, Department Chair and Associate Professor of Pharmacy Practice at the University of Charleston School of Pharmacy. Thank you so much for joining us today.
Well, Bill, I really appreciate your time. I really appreciate this opportunity and to be on your program today. And I look forward to working with you more in the future.
Thank you so much. And I want to thank all of you out there for listening today. If you enjoyed today's program, please go to iTunes, Stitcher, Google Play, whatever your favorite podcast app might be, and subscribe to Rural Health Leadership Radio. Until next week, let's keep working to improve rural health, one conversation at a time.
If you would like to connect with today's guest, please send an email with your contact information to bill@billoxier.com. If you would like to be a guest or suggest someone else as a guest, have a question you would like to ask, or simply want to contact Rural Health Leadership Radio, please use that same email address, bill@billoxier.com. That's BILL@BILLAUXIER.com. You can also visit our website at www.rhlradio.com.
And we'd ask that you please support our sponsor, the Dynamic Leadership Academy for Rural Health. The Dynamic Leadership Academy for Rural Health's mission is to improve rural health, one leader